Thank you, Madam Speaker. It's an honor to rise again on Bill C-19, the Budget Implementation Act, this time at third reading. I'd like to start with what I appreciate specifically about what work was done at committee. I think if some Canadians and neighbours in my community only watch at question period, they might wonder whether anyone here gets anything done at all. But I think the fact is that there are plenty of opportunities in committee where parliamentarians from all sides come together to improve legislation. And I think that's really important to highlight. And so first, I want to point out one really critical amendment that was unanimously passed. And that's one that's going to ensure that all Canadians living with type 1 diabetes, of which there's over 300,000 across the country, will now be able to access the disability tax credit. This is going to help ease the financial burden caused by unavoidable and necessary life-saving expenses. As well in committee, of course, the original bill had the foreign homebuyers ban, but there was no date set for when it would come into force. It was kind of left up to the governing party's discretion. Through committee, there's now a hard date set. It's longer out than I would prefer. It's all the way out to January 1st of 2023. But I think it is an improvement, at least, to have a date now within the legislation. As I've said before, in my community, the extent to which all levels of government work to address the skyrocketing cost of housing will define us over the coming years. And so I wish there was more in the budget, in this Implementation Act, and certainly we need more. Investments like those in co-op housing in the budget that are deeply affordable and dignified housing are a step in the right direction, and having a date in place for when this foreign homebuyers ban will be set into force is an improvement. That being said, these tweaks are insufficient given the moment we're in. And so I'd like to take this opportunity to share 5 significant and urgent priorities of my neighbours that are still missed by C-19 and are the reasons why I can't support it. First, when it comes to the climate crisis, no doubt this is our last chance at a livable planet. The most recent report from the IPCC defined it as an atlas of human suffering. We know that if we want even a 50% chance of staying below a 1.5 degree increase in global average temperatures, that which is required, as scientists from the IPCC tell us, if we want to hold on to the possibility of a livable future for our kids and grandkids. If we're to do our fair share, that means 86% of Canada's proven fossil fuel reserves need to remain unextracted. The UN Secretary General actually went on to say, the truly dangerous radicals are the countries that are increasing production of fossil fuels, that investing in new fossil fuel infrastructure is moral and economic madness. And so, of course, I was disappointed that in C-19 and in the budget, there's nothing here for a prosperous transition for workers that we so desperately need when it comes to retraining and career support, when it comes to pension bridging, when it comes to compensation. In the budget, instead, what we saw was $7.1 billion between now and 2030 in a new subsidy in the form of a tax credit for carbon capture and storage. This is a technology that a recent study from the Netherlands found 32 out of 40 projects they looked at worldwide, when they implemented carbon capture and storage, emissions actually went up. It's one of the reasons why 400 academics penned a letter to our finance minister and deputy prime minister saying, this is a false climate solution. And so unfortunately in C-19, the only time climate is even mentioned is when it speaks about the fact that an annual climate action incentive is now going to be received by Canadians once a quarter. Certainly not the kind of change that reflects the moment we are in, that reflects the crisis that we are in, and that reflects the urgency of action required to meet this moment. The second priority that I'd like to share that continues to be missed here is with respect to addressing the disproportionate number of Canadians with disabilities that are living in poverty across the country. Now, we know that back in 2020, the governing party first promised the Canada Disability Benefit, a guaranteed livable income for every Canadian with a disability across the country. This would lift up, or it could, if done well, 1.5 million Canadians with disabilities across the country. We already know 89% of Canadians support the Canada Disability Benefit. They're, way ahead of parliamentarians here. But we also need to recognize that emergency funds are required to address the very real, direct, and urgent needs of Canadians with disabilities who are living in poverty across the country. And so both in the budget and in this Implementation Act, of course, there's no mention of emergency funds. There's no mention of the Canada Disability Benefit. It was instead introduced as C-22. The same as last year, though, all of the major decisions when it comes to eligibility and the amounts are left to regulation. And so it's going to be really critical for all of us to continue to put the prioritization and the urgency and the advocacy behind ensuring that we get support to Canadians with disabilities across the country. Those are Canadians who need it the most, and we already know that it has support. In fact, it's 103 parliamentarians from all parties who've now come out to say not only to bring it forward in the legislation that has now been done through C-22, which I'm glad to see, but to fast track it and to ensure that the experiences of Canadians with disabilities are heard every step of the way. The third priority I want to mention tonight is with respect to mental health. Of course, in the budget, the only real mention was with respect to a wellness portal. So many parliamentarians speak in this place, recognizing, as it's so important to do, that mental health is health. Well, if that's the case, we need to be looking at organizations like the Canadian Alliance on Mental Illness and Mental Health and their calls for legislation that would put in place a framework for the Canadian federal government to collaborate and support provinces and territories in bringing about parity in mental health support and funding. Of course, that's not here in C-19. It was, as I mentioned, only tangentially mentioned in the budget, and I would continue to advocate and encourage the governing party to meet the moment when it comes to addressing mental health. Just last week, I spoke about the need to honor promises made when it comes to long-term care. This is because so many neighbours of mine have shared their stories, whether these are caregivers who are not in a position to deliver the care that is necessary, or it's those who have a parent who's waiting in a hospital bed for months on end, hoping that their parent might one day have a spot in long-term care. Recognizing the wait list, when the last research I saw last summer was at 52,000 people on a wait list. We still haven't seen this promised Safe Long-Term Care Act. It was mentioned in the confidence and supply agreement between the NDP and the Liberal Party, and would continue to encourage the urgency to be placed on that legislation being moved forward, given that it's not here in C-19. In fact, long-term care is only mentioned in the budget once as it relates to funding that was promised back in 2021. In closing, Madam Speaker, the last critical priority that is urgent, that needs sufficient prioritization in this place, is also as it relates to addressing Indigenous reconciliation, specifically through following through on the 94 calls to action from the Truth and Reconciliation Commission, from the Yellowhead Institute's most recent report on the calls to action. Only 11 of 94 have been completed to date, And so in my view, that's another significant gap here if we aren't doing enough to move sufficiently quickly to follow through on all of the promises made, to follow through on all 94 calls to action. This is another critical moment to do so. Thank you.
Questions and comments, questions et commentaires. The honourable for Calgary Forest Lawn.
Thank you, Madam Speaker, and I just wanted to appreciate my friend from the Green Party speech. He touched on mental health. And my question to my friend is, we see all the time that the Liberal government here says, we've thrown this many millions of dollars, this many millions of dollars, and I'd really like to hear from someone who I feel is very passionate about mental health and youth. What can we do as, let's put the parliamentary side aside, what can we do as community leaders together, and how can we use that money that's, that we hear all about, we've done this many millions, but what can people do to use that money, properly, equitably, and fair amongst the youth so that we can help some of this pandemic that's going on with mental health?
The honourable member for Kitchener Centre.
I really appreciate not only the question, but from the person who asked it, because the member for Calgary Forest Lawn has brought up the Canada Mental Health Transfer many times without anything that I read in it with respect to partisanship, but with an interest in really moving ahead. And we know the governing party has promised the Canada Mental Health Transfer. When I go home and reflect back to neighbours of mine and some of my aspiration for this place, what I often share about is there are examples where so many parliamentarians do agree, and mental health certainly is one of those. And so while I'm glad to share more about the obvious needs in communities like mine and his as well, as a newer parliamentarian here, this is an example where I think as we continue to bring up mental health in this place, that we could put pressure on a government that has said they intend on moving forward. Let's ensure that they follow through on doing so.
Dans un commentaire, the honourable l'honorable député de Thérèse de Blainville.
The honourable member for Thérèse de Blainville. Thank you, Madam Speaker. And I thank my honourable colleague from the Green Party for his speech. I commend him for his very hard work and very appreciated work on social justice, on the environment, persons with disabilities. He's very sensitive to the situations of those who are vulnerable. He said that he was disappointed that in the budget he didn't find a few lines about standards for long-term care. Long-term care is related to the organization of services in all provinces and in Quebec. Would he agree that the best way to support these needs would be for the federal government to transfer money to provinces and to Quebec, money which meets the needs that they have to fix their problems?
Kitchener Centre.
Thank you for the question. I will answer in English only to ensure that I get my words right. Yes, I would agree that funding is critical. National standards for long-term care that are brought about in collaboration and in consultation with provinces and territories, in my view, are also really critical to ensure that we address where we strongly agree, which is that there is a crisis in long-term care, that we've not moved through that crisis yet, and that we need to ensure that we do so much better by our elders right across the country.
Small question, the honourable member for Skeena-Bulkley Valley.
Thank you, Madam Speaker, and thank you to my colleague from Kitchener Centre for a thoughtful and articulate speech. I share his dismay at the $2.6 billion in this budget for carbon capture and storage, not because I don't believe that technology will likely play some modest role in reaching our climate targets, but because this is a direct subsidy to some of the wealthiest and most profitable corporations in our country. $2.6 billion is not pocket change. Could my colleague perhaps provide his thoughts on where that $2.6 billion could be better spent in meeting our climate targets and ensuring a healthy future for our kids?
Sir, from the member for Kitchener Centre.
Well, thank you to the member for Skeena Balkley Valley. I'll recognize it was the NDP who brought forward a motion, I think just last week, calling for repealing, ending all subsidies at a time when, under various names, we continue to see new ones added. To answer the question, we know exactly where those funds should go. They should be going to workers to invest in their long-term future, in a prosperous transition for workers, to ensure that they know that they're going to be a part of the economy of the future.